Welcome to the second video in the series where we look at why mental health is important in New Zealand. Before we get into the statistics on mental health, it's important to consider that not all researchers use the same terminology. So while some studies look at specific disorders, others may look at more general symptoms. Nevertheless, let's start by looking at the good news first. Approximately 70% of young people and about 80% of adults experience a good level of mental health in New Zealand. Now for the not so good news. 1 in 5 adults and 1 in 4 young people are diagnosed with mental health related disorders. Unfortunately, the number of New Zealanders with high levels of mental distress is increasing over time. In addition, these mental health related problems are not spread evenly across the population. In fact, mental distress is highest amongst smaller young people aged 15 to 24 years old who live in isolated areas within New Zealand. Another example that highlights the uneven spread of mental health challenges can be seen in youth suicide statistics. Overall, in a large sample of over 7,000 young people in New Zealand, 6% recorded that they had attempted suicide in the past 12 months. However, for students at low decile schools, this percentage was more than double. When looking at youth suicide rates, a 2020 study found that New Zealand is the second worst of the 41 OECD countries included in the study. We also know from emerging research that the COVID-19 pandemic will have short and long-term effects on the mental health of the people in New Zealand, making this an incredibly pressing issue for us to focus on. In the next module, we're going to discuss what supports and treatments exist for people in New Zealand. Thanks for watching.